Welcome back everyone to sqadia.com. We were talking about the musculoskeletal system. My name is Osama, and the next topic that we are going to cover in the musculoskeletal system is the diseases of the joints, inflammatory arthritis. So, inflammatory arthritis, we are going to talk about ankylosing spondylitis, crystal arthritis, psoriatic arthritis, and septic arthritis. So what is inflammatory arthritis? Inflammatory arthritis is a group of conditions which is characterized by synovial inflammation and morning stiffness and joint pain. So there is an inflammatory process, and the diseases or the conditions which are included in it include rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, juvenile idiopathic arthritis, and systemic lupus erythematosus. So let's start off with ankylosing spondylitis, a very famous disease. You have heard about it a lot, and you get to see and read that in books a lot as well, but it is not as much common actually. And there is a greater predisposition for ankylosing spondylitis in men, specifically in early 20s or the early third decade of life and late teenage. There is prolonged morning stiffness in the lower back and buttocks because of the inflammatory process which is undergoing, and as a person attempts to move, the symptoms starts to get relieved, unlike degenerative joint disease, osteoarthritis, in which the pain increases with movement. Another important thing in ankylosing spondylitis is that there is progressive loss of range of motion. As this condition progresses, there is decrease in the range of motion of the spine, specifically lumbar spine. And what you would observe is there would be a decreased lumbar lordosis and increased thoracic kyphosis. And this decreased range of motion, specifically in the lumbar spine, is also tested in physical medicine and rehabilitation by a specific test which is known as Schober test, which involves marking sites 5 centimeter below the L5 and 10 centimeter above the L5. So that is actually a 15 centimeter distance, and a person is asked to bend forward, which means flexing his lumbar spine. And then that distance, those 2 points are measured again, and there should be an at least increase of 5 centimeter or more. If there is not, or if there's less increase, or if there's no increase, or there hasn't been an increase, so then it means that the range of motion is decreased in the lumbar spine flexion, and it is a positive test. And other than that, because of the decreased movement in the spine, so as you know, ribs also attached to the spine, and they are very integral in the movement of the chest during expansion and inspiration movements. So there's a reduction in the chest expansion as well because of decreased mobility. And another important thing that you would see on x-rays is that there would be a calcification of intraspinous ligaments. Intraspinous ligaments are ligaments which are between the two spinous processes of any segment. For example, there's L4 and L5 vertebra, there would be two spinous processes, and between them there would be intraspinous ligament. So there's calcification of it, and there's also facet joint fusion. Facet joint is actually the synovial joint which is present between the different vertebra, and that is actually responsible for the movement of the spine. So if they get fused, then obviously there is decreased movement, and here you can see in this x-ray as well, because there is increased opacity, there is increased white color, so this indicates that there is facet joint fusion and intraspinous ligament calcification. Here you can also see that this is a normal healthy spine, and in this you can see that there is a specific demarcation of every vertebra. There's a specific line, and you see that their nerves have enough room to exit the central canal. But in ankylosing spondylitis, you can see straightening of the lumbar spine and increased thoracic kyphosis. And you can also see that there is less clear demarcation of the different vertebrae. They are starting to fuse. You can see clear demarcation, no clear demarcation. They have started to fuse, and you can see as they fuse, there is also less space available for the nerve roots to exit the spinal canal, and thus it also may result in neurological symptoms such as numbness and paresthesia. Another condition that we have of inflammatory arthritis is psoriatic arthritis. It is present in almost 20% of cases with psoriasis, which is a condition of skin or dermatological condition. And unlike rheumatoid arthritis, there is asymmetrical involvement of small joints of the hand, whereas in rheumatoid arthritis, as we discussed, there was symmetrical involvement of small joints of the hand. And there is symmetrical seronegative polyarthritis resembling rheumatoid arthritis. Seronegative, so there is no rheumatoid factor, so it is not positive. Other than that, when the condition progresses and its extreme severity, there is a state or there's a stage which is known as arthritis mutilans. And in arthritis mutilans, you would see that the convex part of the joint of the small joints of the hand, for example, you would see that the convex part would be very small and the concave part would be much bigger. Like it would not be perfectly congruent, and it would seem as if you are trying to fit a pencil in a cup. And that is why it is also known as a pencil in a cup deformity, as you can see here. Even though the picture is very small, if you look at the x-rays, you would observe this deformity. And there is also sacroiliitis. Sacroiliitis means inflammation of the sacroiliac joint. Now, there is another condition which is known as crystal arthritis, and there are two types of crystal arthritis, gout and pseudogout. What is crystal arthritis? It is actually arthritis induced by crystals. What type of crystals are those? So, if those crystals are sodium urate crystals, then this is known as gout, which is very common, and you would specifically see the manifestation of it in the first metatarsophalangeal joint of the foot or the big toe, and it is caused by hyperuricemia, which means greater levels of uric acid, and also intra-articular sodium urate crystals. What happens is that it is actually because of increased levels of protein intake, because there are amino acids are converted into urea, which is converted into uric acid and stored in the body before secretion. So if there are greater levels of uric acid, which is known as hyperuricemia, they may be sometimes deposited in the joints, which would lead to crystal-induced arthritis known as gout. So it is 10 times more common in men, and the most common site is the first metatarsophalangeal joint, and there is a positive family history as well, and it is idiopathic sometimes, and there is overproduction of uric acid, or there's renal undersecretion. So if there's renal undersecretion, obviously there would be more uric acid in the body, and then it would manifest as sodium urate crystals in joints. Urate production by the breakdown of purines. Purines are actually involved in the formation of the protein. So protein intake, so greater protein intake would result in greater purines and greater urate production. The other types of crystals which can be present in crystal-induced arthritis are known as calcium pyrophosphate, but that is not known as gout, and it is known as pseudogout or pyrophosphate arthropathy. Here you can see this is the first metatarsophalangeal joint, and you can see that there is degeneration of the joint surfaces because of the deposition of the urate crystals, and they form a tophus here, and the bone is eroded, and you can see that there is erosion of the bone and inflammation of the synovium. Another very dangerous condition is the septic arthritis. It is one of those conditions of the joints which is considered a medical emergency, because if it is not managed, so it can result in systemic infections, and it can also lead to permanent and excessive damage of the joint within a very, very short time. So it is a medical emergency. And what is actually septic arthritis? It is actually the infection of the joint because of most commonly a pathogenic organism and bacteria, Staphylococcus aureus. But in the elderly population, because their immunity is not as much strong, or in the young individuals whose immunity is suppressed, it can also be caused by gram-negative bacteria. So how does this infection occurs? As you can see in this figure, there could be because of an infection in the soft tissue which can extend to the joint, or it can be an infection in the bone, which we already studied is known as osteomyelitis, which can extend to the joint. It can also be because of infection anywhere else in the body, which may travel from the blood vessel via hematogenous route and then infect the joint. It can also be because of external trauma, which may cause infection in the joint, and it can also be because of using a needle, intra-articular needle, like intra-articular corticosteroid injections, or for diagnostic purposes, so that if infected can also cause infection in the joint. Other conditions also include prosthetic joints, which are known as artificial joints, like in total knee replacement or total knee arthroplasty also called, and pre-existing joint diseases, and as I already said, intra-articular steroid injections, and also in diabetes mellitus, because in diabetes mellitus there's a greater chance of infection. What happens is that there is an acutely developed pain, and the joint is swollen, and there is fever, which is a sign of infection. And obviously there is inflammation and the joint is enlarged, so there is decreased function and decreased range of motion as well. And there is one specific manifestation of this arthritis that when you observe it on X-ray, there would be an increased joint space or widening of the joint space as compared to other conditions, degenerative conditions such as osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, in which the joint space was narrowed down, or it was diminished, or it was smaller, but here it would be larger. So that is also a very important point. So what we learned in this lecture was about ankylosing spondylitis, crystal arthritis, psoriatic arthritis, and septic arthritis. I hope it was beneficial for you, and keep on watching sqadia.com.